So this morning's topic is going to be focused on Medicare supplement and stacking Medicare health plans using a Medicare supplement. And in particular, we're going to be talking about Allstate. Allstate is one of our biggest carrier partners. They have a massive portfolio of products in the under 65 space, but what many agents don't know is how incredibly competitive they can help you be in the Medicare space, and in particular, Medicare supplement. So we're going to be focusing on stacking Medicare health plans using Allstate's not only Medicare supplement plan, but many other products that you can stack on top of that. So that's really going to be the focus for here this morning. So first, the question you might be asking is, well, why do we need to stack health plans? Why can't I just go back later and cross-sell whatever you're saying that I should include in a health plan? Well, first thing is that cross-selling does not work. It just doesn't. It never has. I cannot tell you how many times I've heard people in this industry go, how come agents don't cross-sell? The answer isn't that there's something wrong with the agent. It's that cross-selling doesn't work. It takes too much time. It creates too much confusion. And maybe more importantly than anything is it makes the client question the advice that you have provided and psychologically seems like you're just trying to oversell them. Cross-selling sends that message that, hey, I didn't do a good job the first time, so now I'm coming back again, and now the client's thinking, now you're just trying to sell me more stuff. Stacking is a better way than is cross-selling. It's faster and easier, but more than anything else is the client then understands how everything fits together and psychologically seems like they are all just pieces of an overall plan. And that's how I present it. I say, look, Mr. Jones, I'm going to provide you with a complete plan. I want you to know where all the gaps in Medicare are. Now, it's up to you to decide what you want to include and how much you're willing to pay. But it's my job to make sure you know full picture. And that's what stacking really is. It's providing the client with the full picture. It's not harder, it's easier. It's not more time consuming, it's less time consuming than cross-selling. So what might a good Medicare supplement stack look like? And we're going to focus for a moment on Allstate. So Medicare supplement is sort of the foundation of a Medicare supplement stack, plus a Part D plan, pick your favorite, plus accident, plus cancer, plus dental. And we're going to go through each of these here this morning. But really take a snapshot of this. This is a really nice, complete plan that you could provide a Medicare beneficiary. And anything short of this, you are leaving holes in their plan. So let's first talk about Medicare supplement. So one of the reasons why Allstate is really one of the best Medicare supplement stacks around is because you can drive the premium down so significantly. And what product pays the lowest commission of any plan that we offer? Well, of course, that's the Medicare supplement. You might only make, 19, 20, 21%. So you don't want to put too much of their premium dollars into Medicare supplement for your own pocketbook perspective. But more importantly, Medicare supplement has rate increases. It just does. And the biggest downside to doing Medicare supplements are the potential rate increases in the future. Right, Aaron? Aaron is on this call, and he and I talk about this all the time, that really it's the future pricing that is so key to Medicare supplement because you want them to be able to keep this thing even when they're in their 70s and 80s. So you want to try to drive down the premium as much as you can. Now, the problem with doing that is then you can pick up some fly-by-night carrier who you never heard of just because they got the cheapest rate. They come into the market, they have these whiz-bang rates for 6 months, a year, and then they're out of the business. You never hear from them again, and now all the people that bought that plan, rate increases out the wazoo. But Allstate takes a different approach. What they do to try to drive the rate, and I will tell you, they are going to be the lowest rate in almost every state, every geography, every zip code, but only if you know the trick. Only if you're on this webinar, you're going to know how to do it. And here's the trick. It's what you see on your screen. What you're looking for is these questions to be answered yes. And if they're answered yes, you will have hands down the lowest price med sup on the market, and I guarantee you will not find anybody lower. Certainly not anybody of any consequence. Certainly not with a brand name like Allstate. So the first one is, are you living with somebody? Anybody who's 50 or over. Could be a domestic partner, could be a wife, a husband, just needs somebody. Second, are they currently applying for a Medicare supplement? So are they doing it together? Household discount, big deal. Everybody does that. But here's where it gets even better. Number 3, do you own a wearable device like an Apple Watch? And are you willing to share that info? Which, by the way, they don't really track. But it does ask, are you willing to share that fitness data? And then last but not least, billing frequency. Annual is going to have the lowest rate. There's a 10% discount for annual. But I want to spend a minute talking about that Apple Watch discount, because that's the difference maker. And I know it's only a 5% discount, but it's more important than a 5% discount because what Allstate knows is that those seniors that are wearing an Apple Watch care about their health. They're monitoring their health. It's not because Allstate's tracking them. It's because people are tracking themselves. Having an Apple Watch is an indicator that these people are healthier than those that don't. Now, is that 100% of the time just because you have an Apple Watch, if you're 65 years old, that you're healthier than those that don't? Well, the data says yes. Now, it doesn't necessarily mean your uncle who has an Apple Watch and smokes 3 packs a day is the healthiest person. I'm just saying statistically, that means these people are in general healthier and in general monitoring their health. So, Aaron, going back to our conversation about rate stability, the beauty of this discounting model is not this great 5% discount for the activity tracker. What's more important is you're populating their pool with people who are healthier and tend to stay healthier over time because they're tracking it. That's how you keep rates stable. Keep this pool nice and pure, and you're going to end up with great rate stability. Now, you might say, hey, that's not really fair for the guy who's couch potato who smokes 3 packs a day. You're right. This is not for them. Go sell them something else. But for your healthy people, not only will this have the lowest rate in the first year, it's going to stay low because of the kind of clients that it's trying to attract. So what about Part D? So now we got a Med Sup with Allstate. Nice and easy. You already know now what the key is. The key is answering those discounting questions right. But what about Part D? Allstate doesn't have a Part D, so we're not going to waste time talking about that. But it's really important that you understand what's going on with Part D. So let me flip presentations for just a second. Because what you need to know is the impact that you're going to have with Part D for the upcoming selling season due to the Inflation Reduction Act. By the way, I'm really only showing you this presentation because I wanted to let you know that we now have a compliance-approved presentation that you can use to help explain to your clients the impact of the Inflation Reduction Act has on your clients, on your beneficiaries. So what you're about to see is compliance approved, and I'm happy to send it to anybody that is contracted with us for Medicare. In addition, there is also an Inflation Reduction Act flyer, a leave behind, that is a one-pager that gives a summary, again, compliance approved, that you can provide to your clients and help explain the impact of the Inflation Reduction Act and what impact it's going to have on their Part D plans. So let's just real quick. The Inflation Reduction Act was signed in 2022, and the goal was to try to improve Medicare, among other things. It did a couple of things, though, and specifically the Part D is in 2023, it instituted a $35 cap on insulin. It also redesigned Part D. It allowed for drug price negotiating, which allows the federal government to arm wrestle with pharmaceutical companies over drug prices. And it created some drug price inflation limits. So what's changing in a Part D plan? Well, first of all, drug manufacturers are now going to have to pay more of the share of the cost of a Part D plan. In addition, the insurance companies are going to have to pay more. And yes, while the premiums are probably going up, the actual out-of-pocket costs are going to go down for Medicare beneficiaries. Couple things to note about that. So first of all, Part D plans are now going to have a $2,000 max out of pocket. Yep, $2,000. So instead of the old donut hole where you would have coverage, then there'd be a gap, and then you would go into the catastrophic phase, now it's capped at $2,000. The donut hole is essentially gone. You're basically only in the deductible and coinsurance phase, and then once you hit catastrophic, your max out-of-pocket of $2,000 is reached. The last thing is that now Medicare beneficiaries, if they end up with a big copay at the beginning or a big deductible, they now can actually do some smoothing of those costs by paying that cost over the course of the year. So let's just say your Part D plan has a $450 deductible, and you go down to the pharmacy and you walk up to the pharmacist, you get your drugs, and the pharmacist says, "Oh, $450." And your beneficiary goes, "Oh, I didn't know I had $450. I don't got that kind of money." Well, what they can do is literally smooth it out by paying a pro rata portion every month so that they don't have that big hit at the beginning of the year. Yes, this is kind of weird. The government and Medicare plans are going to be financing that deductible, I guess is a way to look at it. But that was a way to try to avoid sticker shock at the pharmacy when beneficiaries were getting their first set of prescriptions. Last but not least, what do they need to know? They need to know that both their MA plans and their Part D plans are going to see some changes based upon what was just shown, and they really need to take a look at their annual notice of change. That's going to be the key thing. Those should start going out here in the next few weeks. So guys, make sure that you have this presentation. Make sure that you have this leaf behind. All of these can be customized with your information on it. If you're working with us on your Medicare, we can have your contact information inserted in these, and that way you can email them, you can hand them out. All of this is compliance approved. Let's get back on track. All right, so we hit the Allstate Med Sup. We did a little detour to talk about Part D plans. Now let's talk about stacking, which is why we came to this call. So Allstate has a really unique set of products that agents can use to stack on to a Medicare supplement. So we already talked about how do we drive the rate down in the Med Sup? The answer is those discounting questions. Talked about Part D and how we keep those prices down. But now we need to make sure that we're providing our clients with a complete plan. And that can include an accident plan from Allstate, cancer insurance, and dental, vision, and hearing. So let's go through each one. So first you might say, why in the world would anybody buy an accident plan for somebody, a senior? Well, the reason is because falls are one of the most common, they are the most common reason why seniors go to the ER. And if you check it out, what you'll find is they are also the number one way that seniors die. It's the fall. That's what really gets them. Everybody talks about heart conditions and cancers and all these other stuff, but it's the fall that is the biggest risk in your retirement. It's that simple. Just falling down is where ER visits and deaths occur with those seniors. So what accident coverage does is it helps protect against those falls. So you might say, well, this person's not a construction worker. Why do you need accident insurance? The answer is because 90+% of them don't have anything to protect them if they need rehabilitative care or long-term care. They don't have it. So once their Medicare pays out whatever rehab that they'll provide, they push out because there's a limit on it. What this does is provides extra money to help provide home care, rehabilitative care, occupational therapy, physical therapy, any of the kinds of things that people need to get back. But what happens is Medicare pushes people out of rehab so fast that they're not fully recovered. So what happens? They fall again. They don't get the therapy that they need. So accident insurance provides that extra protection in the case of a fall, especially for those that don't have long-term care insurance, and 90+% of them don't. What about cancer? Doesn't Medicare cover cancer? Why do I need cancer coverage? Well, anybody who's had cancer, if you know of anybody, you already know what I'm about to say. No matter how much insurance you have, under 65 Medicare or group or otherwise, cancer is the one condition that ends up costing the most in out-of-pocket costs. The average Medicare beneficiary pays between $5,000 and $10,000 in out-of-pocket costs over and above what Medicare pays anytime they are diagnosed with cancer. And of course, it can be significantly more than that. There are significant out-of-pocket costs. They're just going to take my word for it. And without cancer coverage, here's what happens. People end up not getting the care that they need. They end up having out-of-pocket costs they can't afford, ends up having poor treatment, can't travel to centers of excellence that can provide you the sort of health care that you need. Cancer is the one condition that people need some extra cushion. Last but certainly not least is dental, vision, and hearing. Allstate's got a great DVH product, very affordable, and keep in mind, it is the most consumer-demanded product of anything we've mentioned. While accidents and cancer are something that we need to share with our clients, that's an exposure that they have, you don't have to explain that when it comes to dental. Agents are not doing their job if they're not stacking all of these things. All you have to do is share with your client that this was how you can have a complete solution to fill all the gaps. Now, they may choose not to do it all. That's okay. You can't tell them what to do. But if you're not sharing with them how to fill these gaps, you're just leaving them exposed. And then later on, they're going to call you up. How come you didn't tell me that I have this exposure for cancer? We had this cancer diagnosis, and I just spent $5,000, $7,000, $8,000, $10,000 worth of out-of-pocket costs. You didn't tell me that. You don't want to expose yourself as an agent. Great benefits for dental, vision, and hearing too. I just pulled this off the website last night. So this is the most current product grid for Allstate. We already talked about the Medicare supplement and the MedSup discounts. We talked about the DVH. We didn't spend any time on senior indemnity and final expense. We'll hit that on the next one. And then, as you can see, accident. The reason you don't see cancer on here is because that's not listed as a senior product, but obviously it's sold both under 65 and over. So that's one of the great things about Allstate. Really, really great nationwide footprint. There's some states where it's a little light, places like Washington and Vermont, the usual suspects. But otherwise, pretty much got Allstate nationwide. And one of the things I really like about this company is, man, they really look at the industry and try to slice and dice every conceivable way that they can with products that are extremely competitive. Can't emphasize enough how important it is to have Allstate in your bag. It's one of our core carriers. If you guys were at our agent conference, like many of you were, you probably noticed a huge contingent of Allstate people at our event. We are a big distributor for Allstate. We are very important to them. And for those of you who might have missed it, sitting in the middle of our agent conference was the president of Allstate Health. He literally sat there for 2 days learning and sharing. I guarantee you that is the only agent conference that he goes to. And he's been now twice, 2 years in a row. And he's there, yes, as support from Allstate for our organization, but he doesn't have to sit through all of those sessions. He's genuinely trying to learn all that he can and share and help. Great carrier. Of course, great Allstate name. So then you might say, how do you fit all of this into a consumer's budget? That's a lot of stuff. Where are they going to come up with this money? So I always take maybe a little bit of a different approach than other agents. Even in the Medicare Advantage business, I never start the monthly budget discussion at zero. Let me repeat that. Even when I'm selling Medicare Advantage, I never start the discussion at zero, ever. Because if you started at zero, it's impossible to move up. When I'm talking to a T65, I start completely in the opposite direction. This is Jones. How much were you paying for your group plan or your individual plan when you were 64 and younger? And usually I get numbers like 900, 1200, 1500 or more. So once I know that number, I can say, so if you're paying 900 a month on your group plan for your health insurance, what's your budget for Medicare, your Medicare plan? And so often the answer I get is anything less than 900 or anything less than what I'm paying now. Sometimes they'll say, well, I'd like to save some money. So instead of 900, I'd like it to be 500 or 450. I have never in my 30 years of doing this had somebody say, I expect to pay zero. Never. That isn't a consumer reaction. That is an agent who's trying to convince the customer that what they should be paying is zero. So I know we're not talking about Medicare Advantage on this call. I wanted to make sure that you saw that even with a Medicare Advantage, I don't start at zero. Now, when I'm stacking a MedSup, I don't start at zero either. So here's two examples of how I would stack a MedSup with a budget of $300 a month. And this is how I like to do it. So let's just say that client who's paying $900 for their health insurance, and they say, no, my budget for my Medicare plan is $300 plus my Part B premiums. I'll say, so here are two options. I've got your $220 plan, has all the same elements in it, a little less benefit, and then I have the $300 plan because you said that was your maximum budget. So this gives them two choices that has all of the pieces stacked in there. You notice I didn't eliminate anything. All I did was provide a little lesser benefit so that they could have a lower price. So why do I do it that way? Well, the reason is I want to give them a second option that's cheaper, because what that does is it ensures that they at least purchase something instead of leaving it exposed. Because what happens if they say, well, that $300 is fine, but I think I'll eliminate that cancer benefit, and that way it's only $240. I don't want them to do that. I want them to include that cancer benefit. So I offer them a slightly smaller premium by just reducing benefits, not eliminating anything. Then you might wonder, why not offer them a higher one, a $400 one or a $450? Everybody likes to do things their own way. What my experience is if she tells you the budget's $300 and you go in there and say $450, right out of the gate, psychologically, the client is already on the defensive. Well, I already started at $450. I told them $300, and now they're showing me $450. Now I can't trust what I'm going to see from here on. They can't get past it. They tell me their budget's $300, I stay with $300. And it can even go over a little bit, right? So if they say $300 and this plan ended up being $310, that's not going to move anybody's needle. But that's how I like to stack plans together with Allstate. Don't forget, there is a big difference between incomes of the agents that stack and the agents that don't. And it's substantial. And it doesn't even mean you have to sell them every time. It just means you have to present them. It's that silly. You just have to present them every time, and you're going to make triple the income. Isn't that weird? You don't even have to sell those stacked plans, and you're still going to triple your income. Selling the same 4 sales a month, 1 a week, your average commission triples, and your annualized commission also triples, more than triples. It's that simple. You're doing better for the client, and look what you're doing for yourself. And that's just first year. We're not even talking about renewals. Last year, we only had 1 agent qualify for the Allstate trip. Guys, we can do so much better. And I think part of the reason we didn't have more, you guys noticed Steven Weinberger just posted on our Facebook group about how he's going on the Manhattan trip. You might also notice that he's consistently put in business over the course of a year. And so going back to Allstate, they've got a great trip, and there is absolutely no reason why our agents aren't going to have a whole team of people there. We only had 1. So super easy. You got plenty of time. You got all the way through until the end of the year to qualify for this contest. It's a short contest too, right? It only started May 1st. So you're not even that far behind. But if you're stacking health plans, you're going to go. If you're selling Medicare supplement only, let me just assure you, you will not go. How could I be so sure? Because as you can see, everything from the supplemental space counts double. Yeah, way to get to go. And that's the way they make sure that only agents that are stacking health plans actually qualify. Because there's no way if you're just selling MedSup that you're going to get there. Super easy, guys. Just got to keep putting in business every week. Keep stacking health plans. You're going to go to Cabo. By the way, I haven't seen the details on the hotel, but I understand it's a 5-star hotel, all expenses paid, big time activities, parties, and yet not a lot of meeting stuff. So you're really going to want to get on this trip. Okay, talk about leads here for just a second. Since everybody always wants to talk about how they can get more prospects, just in the spirit of transparency, and we got a limited amount of time left. Actually, I'm already kind of over. It's really not something that you're just going to want to go buy leads for. You got to have a marketing plan. But leads absolutely should be a part of that marketing plan. They just can't be the only aspect of it. Hopefully, if you were at our agent conference, you met lots of great lead vendors, and they do a great job. But it's really important that you have a complete marketing plan. So we've got one place that you can go that you can quickly and easily purchase leads. So Lead Center is our online lead system where you can go, assuming you're contracted with us, and purchase leads. They have leads at various price points, including leads that are like $2. Everything meets all of the new compliance requirements, so you don't have to worry about, like, can I call this? Can I not call this? Has this been sold? Has it not been sold? You don't got to worry about any of that. It's all compliant. It's available in all geographies. You can also either buy off the shelf or custom order, but leads need to be a part of your marketing plan. But please don't call me up and say I need leads, because the first thing I'm going to say is, well, what's your marketing plan? And if you say I don't have one, then I'm going to say I can't help you. If you say, here's my plan and here's where leads fit into it, I can help you with that. I'm always looking to co-op agents that have a marketing plan. And I'm looking for 5 that I could do some heavy co-op on a lead purchase through Lead Center. You do have to be appropriately through us, but if you're interested in getting leads for the upcoming selling season, have me co-op it. What I'm going to need, though, is I'm going to need your marketing plan as to how you're going to both convert on those leads, but also how you're going to generate non-lead sales. We're not an organization that just wants agents to get addicted to leads. We want agents with a marketing plan so that they can have leads be a part of it, and I'm happy to support it. Let's get the questions. I know there's a lot of information, and we've already got a little over. Here we go. Virginia's asking, how do you stack on an MA plan? So I love that question, Virginia, because nothing I just went through is different when I stack Medicare Advantage. Nothing. I stack all the same things. I think what makes what I'm suggesting to you so different is where to start the price discussion. Agents that start the price discussion at 0 are going to be stuck with enrolling people in Medicare Advantage plans. You're no longer an advisor, you're a transactional enroller. And not to try to push this too hard, but personally, I have tremendous concern about seasonal transactional enrollers in this business. Agents that make a living doing that are going to continue to be threatened by artificial intelligence and other ways that can be conducted without an agent. What consumers need agents for is advice. And stacking on a Medicare Advantage plan is no different than stacking on a Med Supp. The key to it is really asking what their budget is. Don't start at 0. Start at a number north of that. Now, I will tell you, you are making a huge mistake if you assume that people don't have any money and they can't afford $200 or $300 or even more than that a month. They can. Even poor people can. Frankly, people can't afford not to. They can't afford $5,000 in out-of-pocket costs or $7,000. They don't got that kind of money. They could afford a couple hundred. That's a mistake. Don't start at 0. It's impossible to move off of it. Ask them what their budget was. I always ask them what were they paying before they turned 65. That makes it so much easier because you already know that price point is going to be a lot. Now, let's just say you ask them what were they paying for their group plan, and they say, well, my group plan was heavily subsidized by my employer, and I was paying $40 a month. Okay, that's going to tell you something. Their expectation of how much health insurance should cost is not realistic because they've gotten an employer who so heavily subsidized that their premium was almost nothing. But I never started 0. Next question was, Phil, about comp. How does the comp work? So that's one of the things I like about stacking these plans. You're also going to maximize your income. And I didn't put up a commission grid how much Allstate pays on all these plans. But what you're going to find is that Med Supp has the lowest commission rates, and the highest commission rates are going to be on things like cancer and accident. Dental is somewhere in between. Don't get hung up on the comp. We pay the street level to everybody. And what you're going to want to do is focus on stacking, and you'll make a great living. You'll make triple what non-stacking agents make just because they didn't listen to this webinar and they didn't realize they were doing this wrong. All right. I know we got a couple more questions here, but we've gone way over. I'm so sorry to have kept you over. I know there's a lot of information, but I hope you found it helpful and informative. That's the conclusion of this training. Thank you so much for joining me this morning. Have a great day.